Welcome to the Rehab Hub in Glasgow. I am Sarah Jane, Clinical Director and Pilates teacher. Okay, you've clicked on here because something has made you interested in doing Reformer Pilates. Before you go on, let me tell you where we're different and what type of clients that we work with. So, we are a team of healthcare professionals, so we're either physiotherapy-led or MSK podiatry-led. When you're coming in, it's not just a general fitness class. Our clients tend to have more healthcare conditions. They tend to have stuff going on that's a little bit more complex than what maybe going into a normal kind of fitness type class would be. So let me tell you more. Our clients tend to have musculoskeletal conditions. So they tend to maybe have arthritis, rheumatoid, they maybe have heart problems, they maybe have knee, maybe you're trying to avoid a particular joint replacement, maybe you've had a joint replacement, maybe you've got lower back pain, but you've got some things going on that need a little bit more attention. That when you're coming in here, generally you're going to be working with us, whether it's with physiotherapy or whether it's with MSK podiatry, but you're working with us where we are very experienced in working in that musculoskeletal environment. So we are healthcare professionals first and foremost. Now, we don't work with clients that come in. So say, for example, you just want to come in and get your body into fancy poses and pose on Instagram and, just essentially just get a six pack and that's what you're all about. That is not our client base. Click away. That's not who we serve. The clients that are coming in here generally are over 35. Our oldest clients, 96, so anywhere in that bracket, they're generally that wee bit older. Now, that's not to say someone who's younger, who needs support and help, can't come in. Of course you can, but you've generally got something going on where you're needing a little bit more help than just coming in to get fit, if that makes sense. So you've maybe got lower back pain, knee pain, hip pain, something going on that you need support with. So our clients generally need more additional support. Okay, rather than just coming in to do a fitness type class. So I hope that makes sense. That is where our expertise lies. Now, in here, I'm in the big room. This is called our Studio Reformer room. These things behind me are reformers. This room in here, we have 9 machines. So this is for our clients that are, they've come through our instruction. They know what they're doing. We don't just let you come into the class and go. It doesn't work like that. They go through a little beginner's course, introduction. We get to know them. We get to assess them. And then they're coming into these sessions. These sessions are for those that are well on the recovery. They're doing well. They've maybe got particular things that they're working on, but they're fairly able-bodied. Hope that makes sense. Next door, behind me here, we have the semi-private room. Now, that room we use for clients who is smaller numbers. There's between 4 and 5 people will come into those sessions. So there's a lot more hands-on. It's kind of like an individual session. But for those that maybe need a little bit more attention or specific work onto them, will come into those sessions. But sometimes some of the clients that are coming in here as well that just want that little bit more hands-on will come into those sessions as well. And then through to my side here, there's another room which is for private sessions. So private sessions meaning usually one-on-one, and maybe you're working on particular things where you're possibly just working at something specific for you, or you're just not quite ready to go into a session where there's other people. So there's options there regardless of where you're starting from. But generally the types of clients and patients that come into us have got problems. Okay, they've got something going on, knees, hips, back, somewhere, shoulders, neck. They've got something going on. We have a large clinic out here as well, so physical therapy and podiatry, musculoskeletal injury clinic and full podiatry practice, as well as a gait and posture lab. So when you're coming into us, we have many different choices in terms of, do you need a bit more of a thorough assessment? Have you been round the houses with a particular injury and getting nowhere? Then you have landed on the right page. You're looking at the right thing. Make sure that you pop your details in. What will happen after you pop your details in with this video is we'll send you details on getting started with us. So take a wee bit of time to look at that and read through it and make sure that we're the right fit for you, because we're not for everybody. If you have no injuries, nothing going on, we're not for you. If you're just wanting to get fit and work out, then look at other reformer studios. They will be much more suited. In terms of getting started, everybody goes through a process. So everybody goes through some sort of fundamentals, beginners, regardless of where you're starting from. So there's a process that everybody goes through, and then we then guide them to what would then suit. So everybody's different. I can't say this is exactly what you do, because your needs are different to somebody else's needs. But generally, most people that come through do eventually get to the point where they're able to come into these sessions. And I'll tell you a particular patient, I'll not mention his name, but essentially this particular patient came up, and this was just after COVID, had really, really, really damaged their back and pretty much crawled up the stairs. And that particular patient couldn't even lie on a reformer at that point. They couldn't even lie down, and they were in that much agony. They had to get a lot of physical therapy and rehabilitation to get to a point where they could even just walk. Now, that particular patient is now able to come into these classes here, and completely different person, not in pain anymore, absolutely loving life, able to walk the dog, able to just do normal things. But for that patient, wasn't able to do anything, absolute agony, and lots of different painkillers as a result of that, and now off all of that, living a normal life, no painkillers, no crazy things going on, sleeping well at night, and just got his life back. Okay, that's the type of patients we love to work with. So if you are in pain, now you don't need to be crawling up the stairs, but you've got stuff that you need to work on, hip pain, back pain, lower back pain, postural problems, you need a wee bit more specific help, not just a one-size-fits-all type of approach. So if that resonates with you, then we are absolutely for you. If you want that more bespoke, more focused, and coming from a very science-based, educated base, where physical therapy, podiatry, working in together, this multidisciplinary clinic that we have here, then we're for you. Okay, if you have any questions, don't hesitate to reach out to us. We'd be more than happy to answer. And maybe we'll see you on one of the